Avian influenza, also known as bird flu, was first identified over a century ago during an outbreak among birds in Italy in 1878. The disease was initially described as fowl plague, but it wasn't until 1955 that the causative agent was identified as a type of influenza virus. Since its initial discovery, avian influenza has been recognized in various forms, affecting both wild and domestic birds worldwide. The viruses responsible for avian influenza are classified into subtypes based on two proteins found on the surface of the virus: hemagglutinin, H, and neuraminidase, N. Over the years, several outbreaks of different subtypes of avian influenza have occurred, affecting not only birds but also, in some cases, humans. The H5N1 strain, in particular, has gained significant attention since the late 20th century due to its potential to cause severe disease in humans and its pandemic potential. Avian influenza outbreaks in birds are of significant concern due to the economic impact on poultry industries and the potential for certain strains to cross the species barrier and infect humans, posing public health risks. Avian influenza, commonly known as bird flu, primarily spreads among birds through various routes of transmission, leading to outbreaks in wild and domestic bird populations. The disease can also cross species barriers under certain conditions, posing a risk to humans and other animals. Birds, especially wild waterfowl and shorebirds, become infected with avian influenza viruses primarily through direct contact with secretions or excretions from infected birds. This mode of transmission is most prevalent in natural settings where birds congregate in large numbers, such as lakes and wetlands. The virus can also spread through indirect contact with contaminated environments. Water bodies, feeding areas, and even equipment used in poultry farming can harbor the virus, facilitating its spread among birds. In confined settings like poultry farms, aerosol transmission becomes a significant concern. The virus particles can become airborne in enclosed spaces, leading to rapid and widespread outbreaks among the poultry population. In addition to these transmission routes, there's evidence suggesting vertical transmission, where the virus passes from the mother bird to the egg, although this route is comparatively less common. When it comes to human infections, the transmission of avian influenza typically requires direct or close contact with infected birds or environments heavily contaminated with the virus. Humans can contract the virus by handling sick or dead birds, touching contaminated surfaces, and then touching their eyes, nose, or mouth, or by inhaling aerosols or dust from infected poultry farms or markets. Although less common, these routes highlight the potential for avian influenza viruses to infect humans, particularly those working closely with poultry or exposed to infected birds in other settings. The risk of avian influenza crossing species barriers to infect humans underscores the importance of measures like enhanced biosecurity on poultry farms, diligent surveillance of bird populations, and the use of personal protective equipment for individuals at risk of exposure. While human-to-human transmission of avian influenza is currently rare, the potential for the virus to mutate and spread more easily between humans remains a significant concern for public health. Avian influenza, known colloquially as bird flu, presents a range of symptoms that can significantly vary between birds and humans, influenced by the virus strain and severity of the infection. In birds, the manifestation of avian influenza can span from mild to extremely severe conditions, often without any prior warning signs. Among the most concerning symptoms are sudden and unexplained deaths in bird populations. Affected birds might exhibit a drastic decline in egg production, produce eggs that are soft-shelled or oddly shaped, and show signs of respiratory distress, including coughing, sneezing, and nasal discharge. Visible physical changes can include swelling around the head, eyelids, comb, wattles, and hocks, alongside a noticeable purple discoloration of the wattles, combs, and legs. Other signs such as diarrhea, reduced appetite, lethargy, and uncoordinated movements may also be observed. Highly pathogenic strains, like H5N1, are notorious for causing rapid outbreaks leading to high mortality rates in poultry, often within a very short time frame. When it comes to human infections, avian influenza can mimic the symptoms of more familiar respiratory infections, varying from mild to severe cases. Individuals might experience fever, cough, sore throat, muscle aches, and headaches. More severe infections can lead to significant respiratory issues, including shortness of breath, pneumonia, and in critical cases, acute respiratory distress syndrome, ARDS, which necessitates immediate medical intervention due to its life-threatening nature. Complications can escalate to septic shock, multi-organ failure, or encephalitis, particularly with strains such as H5N1 and H7N9, noted for their severe impact and high mortality rate among humans. The risk of avian influenza underscores the importance of preventive measures, especially for those in close contact with poultry, including wearing personal protective equipment, PPE, and adhering to strict biosecurity measures. For individuals suspected of being infected, prompt medical evaluation and treatment with antiviral medications are vital steps towards mitigating the severity of the infection and improving survival chances. Treating avian influenza in humans involves a multifaceted approach that aims to alleviate symptoms, prevent complications, and address the viral infection directly. The cornerstone of treatment is the early use of antiviral medications, which are most effective when administered as soon as possible after symptom onset. Neuraminidase inhibitors, such as oseltamivir, Tamiflu, and zanamivir, Relenza, play a pivotal role in this strategy, disrupting the virus's ability to replicate within the body. Baloxavir marboxil represents a newer class of antiviral that can also be used against influenza, offering an alternative treatment option. Supportive care forms another critical component of treatment, focusing on maintaining patient comfort and supporting bodily functions while the immune system combats the virus. This includes ensuring patients get enough rest and stay hydrated, alongside the use of over-the-counter medications to reduce fever and alleviate pain. It's important to note that aspirin should be avoided in children and teenagers due to the risk of Reye's syndrome, a rare but serious condition. For cases that progress to severe illness, hospitalization may be necessary to provide advanced care. This can include oxygen therapy for those struggling with respiratory distress and mechanical ventilation for patients with acute respiratory distress syndrome, ARDS. In some situations, especially where bacterial infections complicate the viral illness, antibiotics may be prescribed. For the most critically ill patients, extracorporeal membrane oxygenation, ECMO, offers a last resort option to support heart and lung function. Preventive measures also play a crucial role, particularly for healthcare workers and others who might come into close contact with infected individuals or animals. The use of personal protective equipment, PPE, is crucial in these scenarios to prevent virus transmission. Additionally, in the face of specific avian influenza outbreaks, targeted vaccines may be developed and deployed for high-risk populations or in response to particular strains, such as H5N1. Beyond individual treatment, public health measures are essential in managing avian influenza outbreaks, particularly among poultry populations. These measures can include the culling of infected animals, quarantine of affected areas, and stringent biosecurity practices to prevent further spread of the virus. Ultimately, early intervention, effective use of antiviral treatments, and comprehensive supportive care, combined with preventive and public health measures, are key to managing avian influenza infections in humans. Public health authorities often provide updated guidelines and recommendations during outbreaks to help prevent the spread of the disease and protect public health.